Greetings and welcome to In Depth. I'm Dike and Rostant. When we last spoke with the CEO of the SWRHA, Dr. Brian Amour, he ended our conversation saying that health-seeking behavior, it starts with you. And that is something that we want to interrogate a little more, looking especially at community outreach initiatives. Dr. Amour, grateful to be having this conversation and a follow-up because sometimes you don't get everything that you want. If you try to do everything one time, it kind of dilutes the conversation. But I want you to expand a little bit on that statement that health-seeking behavior, it starts with you in terms of before you reach to a hospital. What are some of those things that we should be keeping in mind a little more?
In terms of healthcare begins with you, it is actually a life course approach, like from cradle to grave. So from the time families become pregnant with children, you have to take care of your unborn. When children are born, you have to ensure that they are fully fortified by availing of the nutrition vaccination programs that are available. Children and adolescent health, same thing, mainly through the schools where we could reach. And of course, in young adulthood, in terms of taking care of yourself, and then as you get older with the onset of chronic disease, you're really trying to live well. And certainly now we have a field of elderly care to ensure that persons who are living longer still live with dignity and still are being taken care of. So it's a life course approach to healthcare, so it's for your entire life.
And you're saying this, and all I have flashing through, well, one of the main images that I have flashing through my mind is a friend of my uncle's who would hear what the doctor's saying. They all buffer lovingly. She's diabetic, but she loves ice cream. So they would tell her, no, she needs to maintain, she needs to look. But she said when she feel for that ice cream, she eat till her head get numb, and then she boil her bush. And what happened after, happened after. But looking at even stepping away from like hospitals themselves and going into communities to spread the word, make sure that people are doing what they need to. There's a unit apparently?
Yeah, we have a unit called the Health Promotion Unit. It was approved by the Board of Directors in October 2022, and therefore we do have a team of dynamic young professionals who are really going out through several outreaches, and we actually operated in a bigger frame because the Ministry of Health would have made it known that chronic non-communicable disease is a major public health concern. And there are also units and arms in the Ministry of Health that we partner with our health promotion unit. So where you see the big signs, like even when you come in here in San Fernando, you see a big sign on the teaching hospital, that basically says, walk enough, drink water, eat your fruits and vegetables. So that's the drive that we have, because mainly chronic disease is a big issue. So the health promotion unit, they have made a lot of strides since 2022 to present, reaching the communities where they are.
And what are some of the things that is possible in terms of when you go into the communities? And we haven't necessarily spoken about primary healthcare, and we'll get there, but going into the communities, what is possible in terms of the things that you are able to do in terms of helping with health as opposed to just spreading information?
Good. Yes. First of all, we make ourselves accessible, so a lot of persons reach out to us, and we also plan to reach out to them. So through the health promotion unit, that's a vehicle. If anyone as a group wants to reach us to have an event that brings health as part of a dimension to the work that they do, they could reach out to us. And similarly, we also practically reach out to them. So what we do when we go out, first of all, through children, we target a lot of schools. We go out to schools, both health promotion unit and the traditional nursing program. So nurses from health centers as well as health promotion unit, they tend to partner and they reach out to schools, and schools reach out to us as well. So we do a lot of stuff there. And we also work with the Ministry of Health to do stuff for children. So for example, we had recently an inspector academy across all RHAs where young children were encouraged to be like the person to tell your family that, listen, mommy, daddy, as you talk about the ice cream not good for you. This is what I learned in the camp. So healthy lifestyles. We did a lot of outreaches for men's and women's health. So over the last 2 years, we would have done over 850 PSA tests combined and over 1,000 pap smears across those men's and women's health initiatives, again, part of a national initiative by the Ministry of Health, but for which our health promotion unit organized the event. So therefore, we have found that some persons like to come in those sorts of settings, in terms of more informal, accessible, community-based settings. And we also do a lot of work with respect to working with a lot of groups, because part of the ministry's drive is also to improve our voluntary, non-remunerated blood donor. That's the person who gives blood freely without expecting anything in return. Health promotion unit, our blood banks, and nursing fraternity, we all work together. So we go out to business places to engage their employees. We also recently partnered with the North Central Regional Health Authority for use of their mobile bus as donated by the Ministry of Health. So we actually come like a caravan too as well. So we can come individually, we can set up in your local area if you want us to come. We can come with a caravan type of approach, and we could partner with anybody who has health as a dimension, whether it's a health fair, whether it's their local work group. We are just prepared to partner.
So you say it's more the blood, so you can actually go to a grouping of people for blood donation, voluntary, we use that word, voluntary blood donations to take place?
Yeah, we have done a lot of that. So we have found that a lot of our business persons who do businesses in the Southwest region, because people that we serve, they live here or they work here. So even in work environments too, so we have partnered a lot with business communities to do a lot of partnerships where basically, yes, we have the capacity to go as an outreach or outpost medical and nursing team to be able to take blood from persons on site as the resources and the safety protocols allow.
And further than just blood donation, which I appreciate a great deal, but what kind of numbers are you looking for or looking forward to catering to when you have these sorts of caravans? Is it that there needs to be a minimum amount of people that will be there, this captured audience for you to go? How does that work out? What are the logistics of that?
We don't have any minimum requirements. So for example, the health promotion unit last year, they did 169 outreaches, and they would have interfaced from their records close to 10,000 persons in the community. And one major drive we have, for example, is vaccination drives as well. If the figures are correct in my head, it's almost close to 2,500 vaccines. That same period of time, they would have done at least about 19 outreaches for blood donations, and I believe the number of units that they would have engaged with is 300 plus persons donating blood across several settings, mostly business and workplaces. So that's the volume of work that we do. Everything adds up incrementally across 169 outreaches. For this year alone, they already have made close to 100 outreaches from January 2024 to present. So we see it's a unit that's growing from an organizational point of view, but we also respect and recognize it's appealing to the community. However, one quick thing I would like to add is that even when we pick up, we do a lot of screening. We do screening for chronic disease. Check your sugar, as you say in Trinidad, which is really check your sugar, check your pressure. I'm speaking just so everybody understands that we understand what they want checked. So first is diabetes, high blood pressure. We do cancer screenings as well. And basically, what we want to encourage the public is that it is all great to come in this sort of settings, but if we pick up something that is abnormal, you're still required to go to the healthcare system, and we have refined it. We can refer to the healthcare system to get you into the place where you need to get further follow-up and further care.
And we will have further conversation when we return from the break. We are speaking with CEO of the SWRHA, Dr. Brian Amour. Stay with us. We return after this. Welcome back. We are speaking with Dr. Brian Amour, CEO of the Southwestern Regional Health Authority, and we've been looking at community outreach, looking at the fact that health-seeking behavior is incumbent upon all of us. But I want to ask, you said that some people may feel the informal setting is a little easier to deal with. It appeals to them, it resonates with them a little more. Some people just don't necessarily like the idea of going to hospital. But if there is somebody who, through a screening on one of these outreaches, sees something, finds out that they need to undertake a certain course of action, do they have to wait a little further back in line to seek treatment because it was a community outreach versus checking one of the established health centers or healthcare facilities?
The short answer is no. It is a reality that if we pick up something abnormal, we understand that persons are coming because they might be concerned, but they feel that there's a wait in the traditional health system. So if they have a concern and their concern is unfortunately validated by our tests, yes, we do have a mechanism. In fact, in some cases, when we had the larger men's and women's health fair, for example, we had specialists on site standby. So it means to say if they pick up something abnormal, there was an opportunity right away to see a specialist. If it is based on in other community outreaches, we don't have a specialist. Yes, we still have a sort of priority access route. But the issue there is that still, where they go through the health promotion community setting or where they come in a traditional health center, we will still prioritize your further care. So it is the case that there is a continuum. It's not an event for us. It is you come, you get screened. If you pick up something abnormal, we do want you to follow through. And we will navigate you through the system so that you can get the definitive test and proceeded on. We have something that we call in know your numbers. That's what we say. You need to know what your numbers are. And therefore, once you know your numbers, then you know exactly how you can manage your health, and we can help you manage your health as a team.
You can't leave me hanging with that. What exactly are those numbers that we need to know?
Know your numbers for us. Basically, you need to know your weight, and for your particular height, it's good to know your height because then there's something called body mass index, which lets us know how healthy that weight is for you. And therefore, once you know what your body mass index is, you'll know whether you are overweight or obese or even underweight. So you need to know your weight, you need to know your height, and therefore we can help you calculate what is called your BMI. You need to know what your blood pressure and blood sugar is, particularly if you have a family history of persons having blood pressure and blood pressure in your family, hypertension or diabetes. And those are the main numbers that you need to know. Other numbers you would like to know are numbers that relates to tests that you ought to perform for cancer screening, like what you call your PSA level for men with prostate issues, what's your cholesterol. But the main numbers in a community setting that we check, your weight, your height, your blood pressure, and your blood sugar. And it is very simple. And it is something that even though we check it for you, we can also encourage you, if particularly have a family history, how you could continue to check it for yourself.
We spoke of one incident where some people just don't like the idea of visiting the hospital. There's the flip side. Some people love a hospital. So they would reach the secondary care. Speak to the importance and the function of primary healthcare systems in terms of like healthcare, community healthcare areas and facilities, as opposed to, well, going there first versus reaching by the hospital first.
Sure. Primary care is for, as I said, to take care of you throughout your life. And I would also like to mention what are emergency departments. Emergency departments take care of accidents, something that is unforeseen, and emergencies, something that could particularly threaten your life or could threaten your limbs, whether it is your upper limb or your lower limb. So life and limb threatening injuries, for example, motor vehicle accidents, gunshots, stuff like that. And in the emergency departments, we are duty bound to save lives. What we have found, though, as you correctly said, is that we do find on average 1 in 3, 1 in 4 persons that come to the emergency department are not going to get admitted to the ward because they do not have a life or limb threatening injury, or they do not have a serious medical condition that could put them at risk of becoming seriously ill. Those persons we triage, and therefore we manage in the emergency department, and we encourage them to go back to the health center. Our data shows that what we have done recently, like a couple of the arches, we have set up what is called now a community laser clinic in the emergency department. What that means is that persons who come, they are not ill to be warded, or that they may not understand what an emergency department is that we now have a team that would see you and educate and inform you as to where's your nearest health center that you could follow up. And therefore, relative to the person that comes, you can't get that same service that you got in that little clinic setting in the emergency department in a more expansive way in the health center where you can get full range of follow-up. So persons would tend to think you'll get through faster in the emergency department. The answer is no. In the emergency department, we place priority on persons with life and limb-threatening injuries. You will not get through faster in the emergency department. You will get through with the same time and actually with a more holistic care in our primary care centers.
I like that fact because some people say, well, if I reach an accident and emergency, well, my business fixed in terms of getting through faster. But especially if the, I guess, triage says that no, you could, you can wait a bit because we have people who have graver instances. We're going to see about them first.
And not only are we going to see about them first, we are duty bound to see about them first because we are, as professionals, we are duty bound with doctors with the Hippocratic Oath, above all, do no harm. We will do a lot of harm if we pay attention to someone who has a condition that they will not die from and leave someone who is at risk of dying. I don't think anybody in society would want that, and therefore we have to prioritize.
So do you think it's because individuals think that they can't get some of those services at healthcare centers?
That may admittedly be the case, and that is where we come in again, and we appreciate forums like this to indicate to the public that primary care does have a lot of services. So for example, in primary care, we do have what we call chronic disease clinics, where we can follow you up with your diabetes and high blood pressure or any other chronic conditions. We have antenatal clinics for pregnant women. We have children's clinics where we deal with vaccinations and anything that happens with children, cough and cold. We also have the ability that you could simply walk in. You don't necessarily have to have an appointment on certain days in the health center where you can walk in. If when you walk in, there is an appointment-driven system there, we will still attend to you because we have a universal access policy from the ministry that we follow at the RHs. It means to say nobody is to be turned away. So if even you come and we can't attend to you right away, we will tell you when next we can. We can reassure you that things will be taken care of. There's nothing here that's urgent that you need to be seen today, and we will work with you at time that you could come back. But as I said, generally, if you do walk in and there's something that needs to be attended to now, we will certainly attend to you now. And those services are available Monday to Friday. With the health promotion unit, what they're doing too, as well as they're going out on Saturdays to some of our health facilities to also open up the health centers for persons to come on a Saturday if they're difficult to come Monday to Friday. So we do that as well.
And that's something I think to be proud of. And I also look at the fact that you said while you're duty bound by the Hippocratic Oath, it is also incumbent upon us to kind of look and see where is the primary healthcare facility in our area so that we can make use of it. In the last minute and a half, stealing some time, that we have Dr. Amour, speak a little bit about the importance of mental health and seeking mental health, because I think people are more inclined to seek medical attention if they do something physical. Mental health, some people might take it to the Lord in prayer, some people have different coping mechanisms, but in terms of seeking medical help for mental health issues.
The short answer is that we are very cognizant of that, and yes, mental health. In primary care, let's start with primary care. Working with the Ministry of Health and with the initiatives of the SWRHA, we are able to tell persons who are in our traditional mental health clinic that we can now see you in an integrated way in our primary care setting. So therefore, mental health, a lot of persons have mental health and they have other physical ailments. So sometimes you'll find patients go with a physical ailment to one clinic and then they believe they have to go to mental health and another clinic, and there's some stigma with that. Now we have the capacity in a couple of our health centers to treat all at the same time with doctors who are trained and sensible and sensitized. So that is occurring. In terms of mental health, we also are able to do mental health assessments with persons who come in. Our doctors and nurses are trained to do many assessments. And if you have any mental health issue, the treatment is just as the same as any physical ailment. I'm saying physical, but it is really the same physical. So mental health can be chronic, just like chronic disease. You can have long-term treatment that you'll need to undergo. And also just like how in physical disease we have lifestyle changes to make, eat properly, eat healthily, mental health, there are also some lifestyle changes, how you manage stress, how you cope with things in life, and therefore we have the ability to counsel and provide those services to help you cope with any mental health issue. So the days of mental health being seen that you have lost touch with reality or that you have to be locked in an institution, those days are long gone. Mental health is part of any other health issue. And some studies show if you do not take care of your mental health, your physical health also suffers. So it's an integrated approach, and we are capable. And this is some of what we are doing right now for mental health in our region and as well as the country, I would dare say, working with the Ministry of Health.
I want to thank you and the team for the work that you're doing and continue to do. Dr. Amour, Dr. Brian Amour, CEO of the SWRHA, getting an idea of some of the things that are happening in communities that you can avail yourself of. And on behalf of the entire TTT team, this has been In Depth with me, Dike Rostant. Thank you so much for joining us.